Hey guys, I'm Paul.
And I'm Bea.
And this is Everything is Boffo. Today we are talking about the private health insurance that is required for Spanish residency.
And we are lucky today to have Ciaran O'Toole join us. He is from Innoinsure, and he is an health insurance agent here in Spain. Hi, Ciaran. Thanks so much for being here.
Hi Paul, hi Bea. Thanks very much for having me on the YouTube video today. I'm really excited to be here, and I hope you are both very well.
Us too, we're very excited. And before we start, I think an introduction is in order for all of our viewers. Can you tell us a little bit about yourself and about Innoinsure?
Yes, of course. So as I said, my name's Ciaran and I'm from Innoinsure. Here at Innoinsure, we are the licensed international office of DKV and the CISA. These are two of the biggest health insurance companies in Spain, and I've been working in health insurance here in Spain for about 2 years now. So I hope to be able to provide you all with very important and interesting information on Spanish healthcare.
So I guess this topic we're so passionate about this topic, and that's why we're so excited to talk to you about this, because, well, we came from the US and we also came from the Philippines. So we have experienced 3 healthcare systems so far in our lives. How do you compare Spain to your experience with healthcare?
Yeah, so Spanish healthcare in general is very well known for how high the standard of healthcare is. I think that's quite well known in Spain and throughout the world. Regarding public healthcare, the public healthcare system is very strong and very good. I've experienced that myself. Of course, working in private health insurance, I've experienced how high of a standard the private health insurance is as well, especially in comparison to my country, Ireland. That's where I'm from. I'm Irish, so the health insurance in Spain, both public and private, is a lot better than the Irish healthcare system. So that's one of the important things that I've seen, the contrast, and how the Spanish healthcare in general is a lot better than other countries that I've seen. And that's one of the main reasons why people choose to go with the private or the public healthcare, because the health insurance is so good.
Yeah, and I think it's really one of the top reasons why we chose to live in Spain. And a lot of people that we know chose to live in Spain because of the excellent healthcare, and they're just very efficient. We get the results right away. We get seen right away. It's nothing compared to what we've experienced anywhere else.
I think that's the thing for me was, when we moved here and we were talking to other people about how much we've paid for private healthcare, and everyone's talking it's free healthcare. But what I didn't expect was how, just like what you said, very efficient. Everyone they're very thorough when it comes to examining their patients and taking care of their patients, and I think that's what really made us fall in love with the system here.
Okay, so we'll get right on to the topic. So for those who are interested in moving to Spain on a visa instead of just being here as a tourist, you will need private health insurance. Can you walk us through the insurance requirements for getting a visa to live here in Spain?
Yes, of course. So it's very important that you, as it's one of the requirements of the Spanish consulates and embassies, that you have private health insurance here in Spain. It's one of the many requirements for the visas. And the generic health insurance requirements that your health insurance policy must meet are the company must be authorized and licensed to operate in Spain. It's really important. Secondly, the health insurance policy must have full coverage, so that's including emergencies, consultations, diagnostic tests, surgeries, both inpatient and outpatient, and also hospitalizations as well must be included. Another important requirement of the health insurance, it must have a minimum coverage of between €30,000 and €500,000. So always really important to take note of this information. And as well, there should be no co-payments, no deductibles, and no waiting periods. And finally, it must include repatriation of remains. So as I said, these are the generic health insurance requirements that your health insurance policy must meet. Although it's always really important to consult and refer to your consulate or embassy's requirements for the visa or residency you are coming to Spain on. So really important to take note of that and make sure your health insurance policy meets all of these requirements.
So when you talk about consult with the consulates, is there anything that you've noticed that's different from the requirements from the different consulates?
Yeah, exactly. So for example, some consulates such as the San Francisco consulate in the US, it requires that pre-existing conditions are not excluded. So the pre-existing conditions must be included in your health insurance policy. So that is just one example of, in the US, the different consulates do have different requirements. So it's always really important to just keep an eye on them requirements.
And then for these requirements, do they include like dental and vision?
Yeah, so regarding the requirements, so having dental coverage or an insurance isn't a requirement of the Spanish health insurance for a visa or residency, although our health insurance policies and a lot of Spanish private health insurance companies do include some dental coverage in their health insurance policies, which is always a nice thing if you're looking to have a nice smile. So it's always important to keep an eye out for the health insurance policies and see if there is any dental coverage included with their health insurance policies. For example, with a CISA, dental care, simple extractions and an annual dental clean, these are all included in the policy. So that's a nice thing to know that it's included in your policy. And then with DKV health insurance, it is the same. So simple extractions, dental care and an annual dental clean are included as well. Although there are 50 other dental procedures that are also included in the DKV health insurance policy. So dental care and dental insurance does vary depending on the Spanish health insurance company. But with our two policies, dental care are included in both. So that's really important to note as well.
Oh, that's like for us, we had to pay separate for our dental. It wasn't included in our policy.
And then we just paid extra to add it to our insurance.
Yeah, so it's a separate coverage entirely.
Did we have that in the US?
What do you mean?
Our insurance, does it include dental?
No.
It's separate?
I don't think there ever had dental
'cause
insurance in the US. No, just here.
Right. Oh, that's why we go to that doctor.
Yeah, we don't have dental insurance in the US, but we go to the dentist every 6 months.
Yeah, it's just I think it's just a struggle. It's just what do you call that? It's just a task. It's to look for a dentist in the US because
the pricing is so different.
So different.
Yeah, and then regarding vision. Vision is included in the health insurance policies as well. So that includes visiting a doctor if you have any issues or need some treatment regarding your eye. So of course, that is covered and included in the health insurance policy. Although anything regarding glasses and contact lenses, that is not covered. So that's maybe something that you'll need to take note of, because glasses and contact lenses are not covered, whereas visiting an eye doctor or any issues or problems with your eye and you need to visit a doctor, that is covered.
So like ailments, anything hurts, that's covered, but just not for the eyeglasses.
Yeah, that's exactly correct. Yeah.
So now I'm curious about the total cost of all these things. Would you be able to give us examples of, I guess, like different age groups or different situations?
Yeah, of course, and price is really important, and important for people to have an idea of the cost that they would be paying. And so the price of health insurance for a 25-year-old for 1 year cover is €660, and that's without any pre-existing conditions. And then the price for 4 people, so a 40-year-old couple with 2 kids, is €2,640. for 1 year and no pre-existing conditions. And then the price of health insurance for a 65-year-old couple for 1 year coverage with no pre-existing conditions is €4,080. So it's, I hope providing with these quotes is giving people an idea of the costs associated with the private health insurance here in Spain.
That's actually, like, the price is really blowing my mind. That's the really good price for two people who are 65. I mean, obviously, you know, the older you get, that's when things start to come up. So, and everything is covered. Like, once they have that private health insurance, they don't have to pay after paying that annual fee, right?
Yes, that's absolutely correct. So that's, as I mentioned, with their policies, that's full and complete coverage. No co-payments, no deductibles, no waiting periods. It includes repatriation of remains as well, and there's unlimited financial coverage. So it's important as well to take note of the price and also what's included in the price as well. So I hope people are able to get a good idea of the costs after hearing these quotes.
I mean, after experiencing the healthcare system here early last year, man, there's no price for how efficient everything is and how they saved my life. So, man,
They were very efficient.
very impressed.
Yeah, 100%. A very strong, healthcare system here in Spain, and that's why people appreciate it so much.
So those prices are for people without any pre-existing conditions. How about if someone does have pre-existing conditions? Does that mean that they don't get coverage? They're not qualified? How does that work?
Yeah, so that's a very important and a good question. So when clients come to us and they have pre-existing conditions, we just require some information and we have some questions on the pre-existing condition or pre-existing conditions. We submit this to the medical review team, and then the medical review team, they will, after looking over their pre-existing conditions, they will provide us with a quote, and then this quote is provided back to the client or the customer, and the pre-existing condition in this, typically depending on the medical review, if it's an increased premium, this covers the pre-existing condition or pre-existing conditions, and they are included in the quote. This result or quote does depend on the medical review team, but the pre-existing conditions are covered and included, which is always really important to note that what you're paying for, your pre-existing conditions are going to be included in that quote.
Okay, so you're saying it's upon review, but if you do get approved even with the pre-existing condition, it's just that the premium will go up, the price will go up,
Yeah.
right?
Yes, absolutely correct. Depending on the medical review, sometimes there isn't an increase, and then sometimes there is an increase in the quote, but we then provide that to the customer. The final quote and the pre-existing conditions are included. It does depend, as I said, on the medical review team, but typically we cover the majority of pre-existing conditions that our clients have.
Oh, okay, so can you give us examples of pre-existing conditions that have been approved?
Yeah, yes, of course. So pre-existing conditions such as high blood pressure, diabetes, high cholesterol, injuries on the body. These are just examples of the different pre-existing conditions that are quite common and that we provide coverage to, which is important for people coming to Spain on a visa or looking here for a residency, that they know in their minds that they are covered no matter what regarding their pre-existing conditions.
So what about for people with prescription? Because I know I had, when we came over, I had a prescription that I didn't know how to handle it. So how about that for the insurance?
Yes, so that's another great question. So with our health insurance policies, and typically this is quite common in the industry, that prescriptions and medications are not covered. So they're not covered with your health insurance policy. Although when you go to a doctor, and if you're coming from the US or from the Philippines, as you mentioned, you will be able to get your prescription. It may not be the same, but you may get similar prescription medication from the doctor. So if you are on any prescription medications, once you come to Spain, the doctors here will be able to help you refill and provide them prescriptions for you. With their ACISA health insurance policy, prescriptions and medications are not covered, although with their DKV health insurance policies, medications are covered. DKV cover up to 50% of the medications and prescriptions, and so this is up to €100 per year.
Cool. And the prescriptions themselves are not expensive if you go to a pharmacy and pay out of pocket, right?
Yes, that's correct. So typically the prescription and the medication here in Spain is cheaper in comparison to other countries such as Ireland and the US and the UK. The prescriptions, medications in the pharmacies are typically a lot cheaper than in other countries. So that is another reason why people prefer living here, because it's a little bit cheaper regarding their prescriptions and their medication. So that's another factor people incorporate when they're making the decision to move to Spain and to ensure that their medications and prescriptions will be able to be refilled, just like where they're currently living.
Man, that alone is just worth. I remember when we moved here. Before we moved here, I asked my doctor to give me extra meds because we're moving here. I don't know how to get my prescription, and I think he just gave me an extra week or an extra 15 days or something. But then when we got here, it was New Year's Eve. So the pharmacy was closed, or at least the pharmacies close to us were closed. So until like the 6th or the 10th or something. So I was able to go get an appointment with the doctor, which was super easy. And then he just gave me, and he was speaking in English, thank goodness. Because we had no background Spanish. So at that time we were looking for someone to speak English. He gave me the prescription and then he sent me to the pharmacy. I got the meds. It was like $250 for 30 days worth, which back in the US, I think with our insurance, we still had to pay $25. So,
wow.
So different.
Wow.
So you mentioned that some insurance companies cover prescriptions and some don't. Is that like a reason or one of the reasons why the pricing can be different between like one company versus the other?
Yes, that's a very common question that we get asked. And what I always say is it's always really important to, when you're choosing and selecting a health insurance, to take in the different factors. Price is one of them, but also coverage is one of the important factors as well. So not always, but most of the time, the maybe more expensive and not the cheapest option is going to give you the most amount of coverage, and having a wide medical network as well is really important. So of course price is very important, but if it's a cheap policy but they do not have a wide medical network and there's not a lot of hospitals, centres and clinics to choose from, then it may not be the best option for you. So choosing a health insurance policy, you have to look at other things, not just the price. So for example, with DKV health insurance, with that policy, as we mentioned, prescriptions and medications, they cover 50% of these costs, up to €100 per year. So that may be a factor why people choose the DKV health insurance. And one of the other factors that people may choose is the emergency travel assistance. So the cheaper health insurance policies may not have the option or as much emergency travel assistance coverage. For example, with our DKV health insurance policy, you are entitled to emergency travel assistance worldwide, except for your home country, for up to 180 days per year. And also this covers up to 20,000 euros as well. Whereas the ACISA policy, which is very similar, the emergency travel assistance is only 12,000 euro, and you're only covered up to 90 days per year. So that's just one of the examples of the health insurance policy, that there's many other factors to choose from, and not just price. So you want to make sure that your health insurance policy you're choosing meets 100% of the requirements of the Spanish visa, has the adequate coverage for you, and also has a wide enough medical network so you have different centers, clinics and hospitals to choose from.
So when we went to the US last year, why did you get extra travel insurance?
Because I only get covered 12,000 euros, and that's probably not enough for the US.
Okay, makes sense. Okay,
No
next
more
question. So all of this is nice, but for my experience, when I was trying to book appointments with my health insurance provider, I went to the website and it was just so hard to navigate the website. Not only was it hard, it was also, I had to do 2 separate browsers because there's an option for English. Well, we were trying really hard to learn the language, but the website itself is not really as helping out. So I shift to English and then I put my information in and the website just goes to a different non-existing page. So I use a different browser and all these things. So I feel like that's one of the other things that people who are looking for insurance providers need to know. And what's your experience when it comes to like apps or websites of all of these Spanish insurance companies?
Yeah, that's very interesting to know. So through our website, once you purchase and you have an account with us on our website, you have the access to request appointments, and then we will receive this information on the specialty you're looking for and the whereabouts you're looking for an appointment, and we can make an appointment for you, which is very helpful for people when they first are settling in Spain and are taking time to adjust to how it all works. And we also have on the dashboard where you can request your digital and physical insurance cards. So if you have any issues and you need your digital or physical cards, you can request them, and then we'll post the physical cards to you, and the digital insurance cards we can send to you via email or WhatsApp. So that's really important to know that you have a dashboard for appointments for your insurance cards and to speak to us. That's a very important thing for our customers. And also regarding the apps, which is a very important question because people need to be able to get this information through their apps on their phones, which is really, really important. So for both DKV and the CISA, both have apps that are very helpful regarding your experience on the app. You can search for hospitals, centres and clinics within your medical network, and you can also book appointments through the apps as well, and submit authorizations as well. So through the app on your phone, you can do a lot of things which are really important when you're looking to, for example, book an appointment, look for a doctor. So it's very helpful that you can do that through your mobile phone.
So I think more importantly, can you filter out the doctors that speak in English? Because that's the hardest part for me was I went to the website of our insurance provider, narrowed down the list to English speaking doctors. I went to the doctor and I asked him if he spoke in English. He's like, no. So yeah, that was fun.
Yeah, so that's a question we get asked a lot, and of course it's really important if you don't speak Spanish and you speak English, or English is your first language. So what we do through the apps and through the medical network sheet, you can filter the language by English. So if you don't speak Spanish and you're looking for a Spanish an English speaking doctor or nurse or an English speaking hospital, you can filter through English, which is really important to know if you're looking for an English speaking doctor. And also an important note to make as well is typically there's English speaking doctors at the bigger hospitals, and you can always filter through the app and the medical network just to find that information.
Yeah, because we thought we were really good in Spanish until he had to go to the ER and they were talking about his vesicula biliar, and we were like, what the heck is that?
Yeah.
So we're like, well, I guess we're not that good yet.
It was a little tough because, you're kind of like feeling like, am I sick? Am I okay? But then, so what the doctor did was he was checking my stomach and, dolor. And I'm like, no, dolor. And then he looked at the nurse. He looked at me again. He looked at the nurse and he's like, your sangre is fantastico. I'm like, oh my gosh. I thought there was something wrong. So it was a little hard, but I'm glad their efficiency was better than my Spanish. So I didn't have to learn. But, to be fair, we're trying to learn Spanish, but, it's
Takes time.
It's going to take some time.
Yeah.
We're doing pretty good.
So you talked a little bit about your website and how they can get some quotes, and if they are your customer, they can you can book appointments for them. So how can they find you?
Yeah, so as you mentioned, I'm sure there's going to be a link provided, and through that link you are sent through our website, and through the website you can find more information on us. If you're looking to contact me and need any help regarding health insurance, any questions you may have, feel free and do not hesitate to contact me. So you can contact me directly through email, or you can reach out to us on WhatsApp or through our website, and we'd be happy to help you with any health insurance questions you may have.
And all of those links are going to be in the description below.
Perfect.
So Ciaran, thank you so much for all the knowledge that you've shared with us and our viewers, especially for people who have a checklist of things that they need to compile for the Spanish consulate. I know when I was able to check off insurance from my list, it felt very good. But now I think it's time for our viewers to know why we're having this interview. What sets you apart? What sets Innoinsure apart from the other insurance agents?
So that's a really important question as well. So regarding us, we are the licensed international office of DKV and ACISA, which are two of the biggest health insurance companies in Spain. So we are not brokers, we are the international office. So that means we can offer exclusive discounts only available to our office, which is really important for customers. And also we with our health insurance, you can purchase 100% online in a matter of minutes, and then within 2 to 3 working days you will receive your health insurance documents for your visa or your residency via email, which is very quick, very easy. We try to make this process as easy as possible because, of course, when you're preparing for your visa or for your residency, it can be very overwhelming. So we make this process as easy for you as possible. We also have pre and post customer support and service in English and other languages as well. So if you are having any difficulties or need some questions, there's always someone on hand via telephone, email or WhatsApp to help you with any specific questions or issues you may have. And also, you do not need a Spanish bank account to purchase our health insurance. You can purchase with any bank account and any credit or debit card from any country in the world, which is really important to know as well when you're purchasing the health insurance. So I believe that's what sets us apart from other health insurance companies. We are there to support and help our clients in their native language, such as English, to just make that a little bit easier for our customers.
So what other languages does customer service speak?
Yeah, so we offer customer service and support in, of course, English and Spanish, but also Arabic, French, Korean, Japanese, Ukrainian, and Russian as well. So we have a wide variety of native speakers in this office to help you with any queries or questions you may have on the health insurance. So that's really important to make people aware of the different languages that we do speak.
Awesome.
Man, I'm sure hopefully we helped someone who's watching this video check that health insurance off their list. Man.
Thank you so much, Ciaran, today for being with us, answering our questions. And we hope that everybody who's watching found this video about the health insurance in Spain, especially private health insurance in Spain, helpful and informative.
Well, thanks to the people who bought us coffee and bought us super thanks on YouTube.
And also, if you have more questions for Ciaran over at Innoinsure, go ahead and click on that link. Ask him questions. He has more actually that he can say, but we're out of time today.
He loves answering questions.
I do indeed.
Well, thank you so much for your time. We really appreciate it, and best of luck to you. We'll see you soon.
Yes, thank you both for having me on today, and I really enjoyed being able to help people, and I hope that I did provide that information for everyone watching. So thank you for having me on, and I really appreciate it. Thank you.